A very good day to Dr. Zurina and my fellow friends. So now I'm going to explain about encephalitis. Okay, first and foremost, what is encephalitis? Okay, encephalitis is an inflammation process that involves the brain parenchyma or brain substance. So unlike meningitis, the encephalitis is an inflammation that involves the brain itself. Okay, and this encephalitis can lead to or can extend into the inflammation or infection of meningitis, and this condition known as a meningoencephalitis. Okay, now we move on to the etiology. So before we goes into the etiology, I like to explain that this encephalitis, there are two types of encephalitis, which can be infectious encephalitis or non-infectious encephalitis. For infectious encephalitis, it basically the encephalitis that caused by organisms such as viral, bacteria or other organism, can be fungal or TB. But for encephalitis, the most common organism that can cause encephalitis is viral followed by bacteria. Okay, for example of virus that can cause encephalitis is enterovirus, RSV, herpes virus, and EBV or HIV. And for bacterial virus, for bacterial encephalitis is very uncommon, but in worldwide there is still cases of bacterial encephalitis. And what are the organisms that can cause bacterial encephalitis? Okay, the organisms are examples such as Mycoplasma pneumoniae, Borrelia burgdorferi, which are associated with Lyme disease, rickettsial infection, Bartonella nenselae, which are associated with cat scratch disease, and these are the example of bacteria that can lead to the bacterial encephalitis. For non-infectious encephalitis, so let me take the post-infectious encephalitis. So for example is acute disseminated encephalomyelitis, which also known as ADEM. And this ADEM is basically is an inflammation in the brain and spinal cord, and occasionally the optic nerve that damage the brain's myelin, which is the white coating of the nerve fibers. And this ADEM usually occurs following the infection such as chickenpox or measles, or less often occurs following the vaccination. Next, for autoimmune encephalitis, example we take anti-NMDA receptor encephalitis. So this encephalitis is a disease that occurring when antibodies produced by the body's own immune system attack the NMDA receptors in the brain. And these NMDA receptors are the protein that control the electrical impulses in the brain, and it also important for the autonomic functions. Let's move on to the pathophysiology of encephalitis. It involves two mechanisms, which is the first mechanism is also known as a primary encephalitis, which involves a direct invasion of the brain by the organisms such as virus or bacteria. And the secondary encephalitis, or it also known as immune mediated encephalitis, and this occurs usually when the immune system is mistakenly attacks the healthy cells in the brain due to the response to the infection elsewhere in the body. Okay, for example, we take ADEM. ADEM is thought to be an autoimmune condition where the body immune system is mistakenly identify their own healthy cells and tissues as a foreign and attack against them. And this attack will result in inflammation and causing encephalitis. Let's move on to the clinical features or clinical presentation of encephalitis. Okay, so for the symptoms, we can divide the encephalitis, whether it is infectious encephalitis or autoimmune encephalitis, in the terms of symptoms. So usually if it is an infectious encephalitis, the patient will have flu-like symptoms such as fever. They may have also headache, seizure, and most prominent symptoms is they have this behavioral change, or their behavior is basically uncharacteristic. And to differentiate from the infectious, the autoimmune encephalitis have their special symptoms, which is acute or subacute progressive decrease in level of consciousness, altered cognition, memory impairment, and some psychiatric manifestations such as sleep disturbance, hallucination, and psychosis. And then move on to the signs of the encephalitis. For example, we take HSE, which is episimple encephalitis. If it is focal, then maybe the patient have hemiparesis. Maybe patient may present with ataxia. The patient maybe have cranial nerve defect. And for the HSE, which is herpes simplex encephalitis, we can also look for evidence of HSV infection in the body. For example, patient may have hepatic skin lesion, jaundice, and hepatomegaly. And for signs of encephalitis, it may be diffuse or focal based on the where the encephalitis is occurs, whether it is involves only one place in the brain or it is diffuse spread. Want to move on out to investigate the encephalitis patient. Okay, for encephalitis patient, it is very important. Likewise, meningitis, we can perform lumbar puncture in order to differentiate between encephalitis and meningitis, because in encephalitis the CSF finding usually shows lymphocytosis with normal glucose and slight elevation of the protein. And this is why we need to do a CSF analysis using lumbar puncture, because it can differentiate the encephalitis from the meningitis. And next, as usual, is since the encephalitis is an infection process, so we can do the basic blood test, which involves a full blood count to look for leukocytosis, lymphocytosis, and then we can do the viral serology test, which can be, for example, PCR, polymerase chain reaction test. And then imaging also plays a role in encephalitis, where we can look for any focal change in the frontal or temporal lobe. Okay, let's discuss about how we manage the encephalitis patient. Okay, for management of encephalitis patient is mainly supportive, which involves monitoring. We provide them with adequate hydration, and we provide them with antibiotics if they presented with fever. And then we have to careful monitor them, see if whenever necessary, if there is a raised intracranial pressure, we have to take adequate measure to reduce the intracranial pressure in order to prevent them from getting cerebral infarction as well. And then specific management for encephalitis is based on organism. So since I mentioned earlier, the encephalitis is more commonly due to the viral cause. So it's very important to give antiviral. For example, if it is due to the HSV, we can give acyclovir. For example, if it is due to the cytomegalovirus, we can give canciclovir. And if HIV, we can give a combination of antiretroviral agents. And then same goes to the bacteria. If this is a bacterial encephalitis, we can give them correct antibiotics according to the organism. And then, as I mentioned earlier, there is an autoimmune encephalitis, and for this autoimmune encephalitis, we can treat them with immunotherapy, which consists of giving steroids, intravenous immunoglobulin, and plus minus plasma paresis. Okay, just like meningitis, a long-term follow-up for encephalitis patient is also required. Let's talk about what are the after effects of the encephalitis. So once the patient recover from the encephalitis, they may have some damage or destroyed nerve cell, and this damage is known as an acquired brain injury. So this effect is usually a long-term, and they usually have this memory impairment, difficulty in concentration, mood swings, behavioral changes, physical problems such as weakness down one side of the body, speech and language problems, and also changes in personality. In addition to that, they have also some impact on social relationship, and returning to work and school can be difficult as well. And for this patient is usually is very important to provide them with rehabilitation, because this can help the person that affected by the encephalitis to develop new skills and strategies for coping with their remaining difficulties. And it's very important to subject this encephalitis patient to the various professionals such as occupational therapists, speech therapists, psychiatrists, or physiotherapists. And specifically for autoimmune encephalitis, the relapse case is usually around 20 to 25% of case. And whenever there is a relapse of autoimmune encephalitis, this may signify the presence of tumor or inadequate treatment. Okay, that's it for this video. Hope you all enjoy my video today and learn something about encephalitis. And for more information, you can look into reference that I'm going to put in the description below. And once again, thanks everyone for their attention and good luck.